My name is Helain Landy. I am the chairman of the Department of OBGYN and a practicing maternal fetal medicine specialist at MedStar Georgetown University Hospital. I take care of high-risk pregnancies in my clinical activities. I do a lot of ultrasounds and associated procedures involving prenatal diagnosis. And I still do some deliveries. I think pregnancy is a wonderful time. For some patients, it's very challenging. And I think it's important for the patient to try and enjoy what she's going through and work with the providers to be able to achieve that, especially if there are some challenges, being able to have a positive influence on the outcome. Being able to relate to the patient as a person, as a woman, to try and give a little bit of sensitivity to the patient really makes my day. I recently saw a patient in the office, and I took care of her 20 some odd years ago. I delivered her daughter prematurely after a very, very high-risk pregnancy, and she and I embraced and cried, and all the memories of what we went through as a team to bring her daughter to life and to succeed as she is now graduating college. That type of experience just will stay with me forever. I like to impart a common sense approach to patients and patient care, even in some of the highest risk situations. I like to have a good dialogue between the patient and the caregivers so that we're all on the same page and we all understand what the issues are, what the risks are, and what the plan is. It's not always so easy, but at least so that there is open communication. I just think that my job as an obstetrician gynecologist has afforded me the opportunity to be important in so many lives, to make a difference in so many lives. And I just want to say that all of those women that I have taken care of through the years have definitely made my life fuller and made me feel like I've made a difference. And I think that's one of the most important things for anybody going through this world, is to feel that you've been able to connect and make a difference. At Georgetown, we can take care of all sorts of patients with all sorts of problems. We can take care of patients who are completely normal and have low-risk pregnancies, and we can take care of the highest-risk patients. We have constant availability for our specialists in various medical specialties and surgical specialties. We can also take care of those patients who deliver quite prematurely. Our NICU is staffed and available 24/7 to be able to take care of the sickest babies and the smallest babies, as well as those babies that have other problems that require some surgical intervention or detailed evaluation and care. Our obstetric providers work as a team. We have nurse practitioners in our office. We have general obstetrician gynecologists who work as a team in terms of taking care of all our patients. We have availability of maternal fetal medicine specialists to assist in the management and the evaluation of high-risk patients. Our nursing staff on labor and delivery in the maternity units care for patients at the highest level and the most compassionate level. We pay attention to the emotional and spiritual needs of the patients, as well as the physical and medical needs as well. We offer complete obstetric care for patients in a very conducive setting. We have 24-hour availability for anesthesia, whether that's just for identification of a patient that may need a C-section or for pain control with epidurals. We have a full-service organization between our office, which is located adjacent to the hospital labor and delivery suite, as well as our state-of-the-art prenatal diagnostic and ultrasound center. Before a patient is contemplating pregnancy, it's a good idea to have a visit with her doctor or nurse practitioner to discuss being healthy before getting pregnant. There are a lot of things that are important to know ahead of time. Certainly, if she is smoking or drinking, those activities should be curtailed. And if she's on any particular medication, that may need to be changed. It's a good idea to discuss what's safe and what is not safe during pregnancy. What's very important is folic acid supplementation, and what's recommended is the folic acid supplementation at least 3 months before conception. Folic acid deficiencies have been linked to certain birth defects. So eating a healthy diet, which is important, may not give the right amount of folic acid that's necessary to prevent these birth defects. So meeting with the provider can help identify these type of issues, vaccination issues, get some medical issues under control, things like that. A healthy diet is important. There's a lot of common sense recommendations during pregnancy. So a well-balanced diet with good amount of carbohydrates and calcium and protein, very important. We usually recommend that women who are carrying singletons increase their caloric intake by about 300 calories a day. Women who are carrying twins or higher need to increase their diet even more. Early in pregnancy, there may be a lot of nausea and food aversions, so we usually recommend some bland diets, eating more frequent meals rather than 3 large meals, having 6 smaller meals, and especially to avoid the nausea, a lot of people do recommend having some crackers at the bedside. Eat them before you wake up, have them there in the middle of the night for when you do wake up. Prenatal vitamins are important to take during pregnancy, and actually to take a little before pregnancy for the folic acid supplementation. But most women can't get enough of the folic acid and iron that they need during pregnancy, so prenatal vitamins are recommended. The prenatal vitamins can be either by prescription or over the counter because the formulations are virtually the same. Fish intake has been associated with high mercury levels, and high mercury levels during pregnancy can cause certain problems with the development of the fetal brain. So although fish is good in terms of omega-3 and fatty acid supplementation, it is recommended to cut out certain fish such as tilefish and swordfish, shark, and limit the intake of certain other fishes such as salmon to about once a week. Shellfish can be eaten about twice a week. There are very good references online through the FDA and also through the American College of Obstetrics and Gynecology that can help guide patients who have certain dietary restrictions or limitations. An infection of listeria in pregnancy can cause the patient to get actually quite sick, but has a specific effect on the developing fetus and can lead to stillbirth and miscarriage and loss of the pregnancy. The biggest offenders are those foods that are either processed deli meats, for instance, undercooked hot dogs, sushi, undercooked raw meat, and processed cheeses, the soft cheeses such as brie, things that would not necessarily be fully pasteurized. So those foods are recommended to be avoided, and in terms of the meats, to be sure that they are fully cooked. Well, there are a number of things that a pregnant woman should avoid. One of them is, especially in the first trimester, to avoid hot tubs and saunas, things that can cause her core temperature to get up too high. Another thing that's important for those patients who have pet cats is to avoid changing the litter box, and this actually should stop prior to conception, especially for those cats that are outdoor cats and go outdoor and indoor. Cats can carry toxoplasmosis, which is an infection that if the woman is exposed to during pregnancy can cause certain fetal birth defects. So that is not recommended during pregnancy. Alcohol is not recommended during pregnancy at all. Alcohol intake has been linked to fetal alcohol syndrome, which is the major cause of preventable mental retardation among newborns. The issue is that the fetal brain is uniquely sensitive to the effects of alcohol, and we don't know what the lower limit of intake is safe. So it is really recommended prior to pregnancy to avoid excessive alcohol intake and not to drink any alcohol during pregnancy. Yes, you can drink caffeine during pregnancy. Unless you are drinking excessive amounts of caffeine, it is considered to be safe. Older literature suggested an increased risk of miscarriages and low birth weight in patients that were drinking a lot of caffeine, but that does not really seem to be the case. 1 cup of coffee is probably fine during pregnancy. Exercise is definitely recommended during pregnancy. Having a healthy lifestyle includes exercise, and there really should not be any specific limitations in terms of a woman's desire and ability to exercise during pregnancy. Now, clearly, if it's a high-risk pregnancy or there's an increased risk of complications, the woman's doctor is going to recommend that she refrain from exercise. But moderate exercise, especially not involving anything that could physically hurt her, put pressure on her abdomen, would be recommended to be continued. Walking, swimming, working on a stationary bike, all of that is really recommended. Again, just like exercise, intercourse is fine during pregnancy as long as there are no complications and suggestions by the provider to avoid it. Later in pregnancy, it can be uncomfortable, and we just recommend that patients avoid being flat on their backs. Airplane travel is fine up until about the last 4 to 6 weeks of pregnancy. The airline personnel get a little nervous when they see a very, very visibly pregnant woman coming onto their plane, but it is recommended because you don't really want to end up in an area where you go into labor and you're not back at the home front. With any type of travel, sitting in one position for a long time can be associated with increased risk of blood clots developing in the legs. And so we do recommend that women keep well hydrated. If they're on a car ride, if they're in a car ride or on the train, they should make sure they get up and walk around, move their legs, and the same thing is true for airplane travel. The safest time to travel on an airplane is in the 2nd trimester. Please do. Dental work is fine during pregnancy. Even if patients need to have dental x-rays, the appropriate lead shields can be used. Women can certainly go to the dentist and have their regular checkups as needed. There may be some additional gum bleeding during pregnancy, but that is fine. We usually communicate to the dentists if any procedures are necessary regarding what antibiotics, if anything, would be safe, and the use of any medication. But it is encouraged to have healthy gums and healthy teeth. It's probably not recommended that you do the painting. It's recommended that somebody else do the painting just so that you're not exposed to all the toxic fumes. And that goes with any type of chemical exposure in terms of solvents or what have you. It's best to avoid exposure in the air to these substances. And if you need to be in a place where there are these chemical exposures, there should be adequate ventilation. The windows and doors should be open. It's okay to paint the baby's room or have the baby's room painted, but it probably is not a good idea for the pregnant woman to be the only one in the room painting the baby's room. Yes, it is safe to dye your hair during pregnancy. Just like any type of exposure, we have to make sure that there's adequate ventilation. Although no real data exist, I do tell my patients to try and wait until the 2nd trimester because a lot of the potential risks to a growing fetus in terms of birth defects do occur in the 1st trimester. But it's certainly okay to dye your hair. Women who are of normal weight should aim to gain about 25 to 35 pounds if they're carrying a singleton. Women with twins, the weight gain is going to have to be more. On average, it's probably around 2 to 4 pounds in the first trimester and then about a pound a week after that. New guidelines have really put some stricter limitations on weight gain, partly because the amount of obesity and diabetes in the adult community is so rampant, and a fair amount of that may be due to pregnancy weight gain. But we do know that healthy babies and healthy pregnancies result from an adequate weight gain of the mother. Women who are starting out underweight should be gaining more weight. Women who are overweight should gain less, maybe 10 or 11 pounds, and those who are morbidly obese may even be recommended to lose a little bit of weight. Morning sickness is the term used to refer to the combination of nausea and vomiting, usually in the first trimester. It doesn't always occur in the morning, and it doesn't always just get limited to the first trimester. Some women can have significant problems as a result of persistent nausea and vomiting during pregnancy. In most cases, it's self-limited and can be controlled by proper diet in terms of bland diet, eating more frequent meals instead of 3 large meals, having meals with snacks, and in rare cases, patients may actually have to come into the hospital for some fluid resuscitation and intravenous medication. There are some medications that can be prescribed if needed. There are also some over-the-counter remedies that may assist in a patient's symptoms, things like ginger or the wristbands that are used for patients who have motion sickness. Morning sickness is related to the hormones of pregnancy. We know that women who have twins, therefore more hormones circulating, can experience worse morning sickness. But it really is not related to any specific level of a specific substance in the body. And so there's really no good explanation. We do know that, and we do tell patients that when they are feeling sick, it usually means that things are going okay. We're one of the few practices that feel okay when our patients are sick. Breastfeeding is very important, both for the mother and for the baby. For the mother, it really does help for her to lose that weight that she's gained during pregnancy. But for the baby, there are numerous benefits. Minimizing certain diseases, the risk of illness. It helps to transmit the maternal antibodies to ward off certain infections that can be pretty prevalent and devastating during the first year of life. So breastfeeding is really important. And at MedStar Georgetown University Hospital, we are a baby-friendly institution. Just was named this designation, the only one in the District of Columbia, where we are not only supporting and encouraging patients to breastfeed, but we have tremendous resources in this area. Patients are encouraged to discuss breastfeeding with their providers during the pregnancy and to contact the lactation consultants, try and get prepared for what breastfeeding involves. It is not necessarily an easy process. It takes work on both the mother and the baby's part, but it is definitely worthwhile. The high-risk pregnancy can really refer to any pregnancy that's complicated by pre-existing maternal issues or issues that develop during the pregnancy, either for the mother or for the baby. Any patient who has a pre-existing medical condition may be considered a high-risk patient. Patients who have things like chronic hypertension or diabetes, patients who have lupus or who have experienced complications such as blood clots in their legs or lungs, or somebody that has an underlying cardiac or pulmonary disease. Those are conditions that could pose significant problems both to the mother and to the developing baby. And so those are conditions where preconception counseling is definitely recommended. Some of the maternal medications may be important in terms of changing them or limiting them during pregnancy. And especially in patients who have diabetes, for instance, preconception counseling is critical because the higher the sugar level is at the time the patient conceives, the higher the complication rate, including miscarriages and birth defects. Many patients with complicated medical histories will be seen to discuss the possibility of future pregnancies. And in my many years of seeing such women to discuss future pregnancies, it's the minority of patients in whom we do not recommend a future pregnancy. In most cases, patients' medical conditions can be controlled, managed in conjunction with their internal medicine physicians and their specialists. But a good partnership between the patient and her doctors is key for having a healthy outcome for both mother and baby. Advanced maternal age is considered patients who are over 35 at the time of delivery. One of the big things with women who are older is that there's an increased risk of genetic abnormalities in the babies. This is chromosome abnormalities, the most common of which is described as Down syndrome or trisomy 21. It is well known that the risk of these chromosome abnormalities increases as a woman gets older. For instance, by the time a woman is 40, the risk of Down syndrome affecting her child could be as high as 1 in 78. Now, women of older age also have higher complication rates, but not so much that it would require ongoing care specifically by a high-risk physician and thus excluding the patient's general obstetrician. Women who are older have increased risk of developing certain medical problems like hypertension or pre-eclampsia, that is a hypertensive problem that develops during pregnancy. They also have an increased risk of developing diabetes and other problems like high cholesterol, things that may or may not be important in terms of carrying a pregnancy. We know that older women have a higher risk of infertility and a higher risk of miscarriage. In our practice at Georgetown, over a third of the patients that we care for are considered advanced maternal age. And so we work very closely as a team to provide the medical and genetic and prenatal information that is necessary to assure a healthy outcome for both mother and baby. We have a full-time genetic counselor who will meet with patients to discuss their genetic risks. We have a full access ultrasound area where we do our sonograms that involve the prenatal screening for certain birth defects, both in the first trimester and in the second trimester. And we have access to any of the medical specialists that are necessary in terms of coordinating care for patients with complicated medical issues. So advanced maternal age is something that we are very aware of, and we take care of many patients with this condition. Does not really constitute a reason for being considered high risk. Pregnancies can become high risk with no real warning. Patients can develop diabetes during pregnancy. Patients can develop hypertensive problems such as preeclampsia. And preeclampsia, which used to be known as toxemia, is a problem that is always described as a triad of findings, including high blood pressure, protein in the urine, and swelling in the legs. The bottom line for preeclampsia is if it is severe, a patient really needs to be delivered. So preeclampsia is something that we pay attention to all the time. Every obstetrician takes care of patients and is always watching for the development of preeclampsia. There can be birth defects that develop or become apparent on the sonogram. There can be problems with the amniotic fluid. There can be problems with the placenta, where the placenta is located. If the placenta is located over the cervix, it's called a placenta previa, and can be a problem, especially if it persists, can interfere with the delivery process, and also it can result in a fair amount of bleeding and issues that would change a patient's pregnancy from being completely normal to high risk. Women who have multiples, twins, triplets, or higher, are certainly considered high-risk pregnancies. Although, again, there are many twins that are born to very healthy women, and not every twin pregnancy is considered a high-risk pregnancy. Another reason that a pregnancy may become high risk is the possibility of a preterm delivery. For instance, if there are premature contractions, or if the cervix has started to dilate or shorten, or if the woman's water bag breaks prematurely. Those are very high risk situations, might require a patient to be hospitalized, or if not hospitalized, to remain at bed rest or limited activity at home. And with an increased risk of a premature delivery, those patients should be watched very closely.